The Pediatric Adolescent Diabetes Research and Education Foundation, known as the PADRE Foundation, is a nonprofit organization dedicated to supporting the needs of Southern California children and adolescents who have type 1 diabetes and their families through a program of diabetes health education, support groups, and events. PADRE's programs help many low-income and vulnerable children who live with a very challenging disease of type 1 diabetes. PADRE provides over 100 classes and support groups annually to approximately 2,000 children and their parents and siblings, providing them with much-needed diabetes self-care education that goes beyond what is provided at initial diagnosis. First off, type 1 diabetes is an autoimmune disease in which a person's pancreas stops producing insulin, a hormone that is needed to make energy from food. Without insulin to transport the sugar, glucose, or energy into the cells, the sugar remains in their bloodstream, giving them high blood glucose readings. If the cells do not have sugar to use for fuel, their body then begins to use muscle and fat as a fuel source. The byproducts of muscle and fat metabolism are a poison to their system and can cause coma and death. The PADRE Foundation was founded in 1985 by a concerned parent of a child newly diagnosed with diabetes. Due to a lack of support services to educate families about living with type 1 diabetes, over the years, PADRE has grown into Orange County's only provider of education and support exclusively to children and adolescents who have diabetes. It is also based at CHOC's Children in Orange. Today, PADRE serves more than 2,400 pediatric patients annually throughout the greater Southern California area. As an independent nonprofit organization, PADRE is dedicated to serving the community through its free diabetes self-care and support programs. These programs are designed to improve diabetes self-management, which positively affects the health outcomes of youth participants, and teaches valuable coping skills which ultimately strengthen the family function. Type 1 diabetes onset has nothing to do with diet or lifestyle. There is nothing that can be done to prevent it, and currently there is nothing to do to get rid of it. Therefore, until there is a cure, PADRE's mission is to provide educational classes, support groups, and psychosocial events for all children with diabetes as well as for their parents and siblings, support community education on diabetes and disease management, partner with research efforts aimed at better detection, prevention, and management of diabetes, and ultimately toward finding a cure. As Healthy People 2020 Diabetes Objective 5 is to improve glycemic control among persons with diabetes. The PADRE Foundation is an independently operated nonprofit organization sponsored by and partnered with numerous organizations such as CHOC Children Hospital, Pacific Life Foundation, Mary and Dick Allen Diabetes Center, and major sponsors include Coastal Conservancy and Tandem Diabetes Care. They also rely heavily on their volunteers to make each of their events amazing. In addition, their programs are 100% funded through philanthropy. On a monthly basis, PADRE offers specialized classes such as insulin shot class and pump basics class, which assist in managing type 1 diabetes. They are taught by the diabetes team of CHOC and include certified diabetes educators and registered dietitians. In addition, the PADRE Foundation hosts numerous fun activities for children and families such as family retreats and an annual fashion show. The purpose of these activities is to enable these children to have a sense of normalcy and to enable them to be side by side with their peers who too have type 1 diabetes. PADRE markets their programs by giving teens with type 1 diabetes the opportunity to represent the foundation, to provide diabetes education to the community, and to raise diabetes awareness. The teens, called youth leaders, accept the responsibility to represent PADRE in public settings and help promote their mission. A great program that PADRE offers is carbohydrate counting class, which is offered 2 to 3 times every month. The objectives of the program are to be able to create lifestyle habits based on healthy eating and exercise, be able to read nutrition labels, and use resources to accurately count carbs for insulin dosing. All in all, make meal planning easier by balancing carbohydrates eaten with insulin and exercise. Many of PADRE's classes are taught in Spanish, which enables them to address the needs of those Spanish-speaking families with type 1 diabetes. Additionally, all classes are provided at no cost as more than half of those the foundation serves are low income. Moreover, most of the board members have either a son or daughter living with type 1 diabetes and know firsthand what a positive impact PADRE has in the lives of their children and families. Although PADRE has reached many families, they know there are many more out there who need this amazing organization. Susan Brennan is the Chief Executive Officer who began her affiliation with PADRE Foundation in August 1996 when her son was diagnosed at the age of 15 months. She became president of the board in 2008. Mary Mailman is the director of PADRE, who first learned about the foundation when her daughter was diagnosed with type 1 diabetes in 2009 at age 8. For more information about the PADRE Foundation and how to donate, volunteer, or learn more about the classes and programs offered and events, you can do one of 3 options. Visit PADREFoundation.org, call their office at 714-509-8330, or visit their main office at 557 South Main Street, Orange, California. Thank you.